NHA CCMA free practice questions. Question 1. Which insurance model requires patients to choose a primary care provider, PCP, and obtain referrals to see specialists? Option A, Preferred Provider Organization, PPO. Option B, Health Maintenance Organization, HMO. Option C, Workers' Compensation. Option D, Indemnity Plan. The correct answer is option B, Health Maintenance Organization, HMO. HMOs require members to select a PCP who coordinates all care and issues referrals to in-network specialists. PPOs allow direct access to specialists without referrals, offering more flexibility at higher cost. Question 2. A medical assistant notes a prescription for a Schedule II controlled substance. Which of the following is a characteristic of Schedule II drugs? Option A. They have no accepted medical use in the United States. Option B. They have a high potential for abuse but are accepted for medical treatment. Option C. They can be refilled up to 5 times within a 6-month period via phone. Option D. They carry a very low risk of physical or psychological dependence. The correct answer is option B. They have a high potential for abuse but are accepted for medical treatment. Schedule II drugs have a high abuse potential with severe psychological or physical dependence risk, yet are accepted for medical use with strict prescribing controls. Schedule I drugs have no accepted medical use. Schedule II prescriptions cannot be called in by phone or refilled. Question 3. A medical assistant is speaking with a patient who is angry and shouting about a billing error. Which technique is most effective? Option A, shout back at the patient to command control of the situation. Option B, remain calm, use a quiet tone of voice, and listen actively. Option C, hang up the phone or walk away immediately without speaking. Option D, tell the patient that their behavior is completely unreasonable. The correct answer is option B. Remain calm, use a quiet tone of voice, and listen actively. De-escalation requires the medical assistant to remain calm, lower their voice, and demonstrate active listening. Matching the patient's volume or dismissing their concerns escalates the situation. Acknowledging the patient's frustration while working toward a solution is the therapeutic approach. Question 4. A medical assistant observes that a hematoma is beginning to form rapidly during a venipuncture. What should be the assistant's immediate action? Option A, adjust the depth of the needle to stop the bleeding. Option B, advance the needle further into the vein. Option C, remove the tourniquet, withdraw the needle, and apply pressure. Option D, have the patient pump their fist to redistribute the blood. The correct answer is option C. Remove the tourniquet, withdraw the needle, and apply pressure. Hematoma formation indicates blood is leaking into surrounding tissue, likely because the needle has exited the vein. The correct response is to release the tourniquet immediately, withdraw the needle, and apply firm pressure to minimize bruising. Advancing the needle worsens the injury. Question 5. A medical assistant is coordinating a specialist referral for a patient with severe osteoarthritis. What information must be verified before the patient's appointment? Option A. The patient's credit history and score. Option B, prior authorization from the patient's insurance company. Option C, the specialist's personal cell phone number. Option D, the patient's driving record for transport purposes. The correct answer is option B, prior authorization from the patient's insurance company. Many insurance plans require prior authorization before specialist visits to confirm medical necessity and ensure the referral is a covered benefit. Failure to obtain prior authorization may result in claim denial and unexpected out-of-pocket costs for the patient. Question 6. What is the fundamental functional unit of the nervous system responsible for transmitting electrical impulses? Option A, nephron. Option B, alveolus. Option C, neuron. Option D, osteon. The correct answer is option C. Neuron. The neuron is the structural and functional unit of the nervous system, transmitting electrochemical signals throughout the body. The nephron is the functional unit of the kidney, and the alveolus is the gas exchange unit of the lung. Question 7. A medical assistant performs a clinical task that is strictly outside their legal scope of practice, resulting in harm to a patient. This is an example of which legal concept? Option A, nonfeasance. Option B, malfeasance. Option C, contributory negligence. Option D, slander. The correct answer is option B. Malfeasance. Malfeasance refers to performing an act that is unlawful or wrongful, such as practicing outside one's legal scope of practice. Nonfeasance is failure to act when there is a duty to do so, while misfeasance is the improper performance of a legal act. Question 8. A medical assistant is preparing a patient for a Holter monitor application. Which instruction should be given to the patient? Option A, avoid taking a bath or shower while wearing the monitor. Option B, remove the monitor electrodes if they become itchy. Option C, do not engage in any normal daily activities or walking. Option D, disconnect the monitor before going to sleep at night. The correct answer is option A. Avoid taking a bath or shower while wearing the monitor. Patients with Holter monitors must avoid water immersion, including bathing and showering, as moisture can damage the device and interfere with the recording. Patients are instructed to continue all normal activities, since the purpose of the monitor is to correlate cardiac rhythms with daily activities. Question 9. Which of the following medical abbreviations represents a medication that should be taken 4 times a day? Option A, BID. Option B, TID. Option C, QID. Option D, PRN. The correct answer is option C. QID. QID stands for quarter in die, meaning 4 times a day. BID means twice daily and TID means 3 times daily. PRN means as needed and is not a fixed frequency. Question 10. An orthostatic blood pressure measurement requires the medical assistant to check the patient's blood pressure and pulse in which sequence of positions? Option A, sitting, supine, standing. Option B, supine, sitting, standing. Option C, standing, sitting, supine. Option D, prone, Fowler's, lithotomy. The correct answer is option B. Supine, sitting, standing. Orthostatic vital signs are measured supine first, baseline, then sitting, then standing to detect positional drops in blood pressure. A systolic decrease of 20 mm Hg or more upon standing indicates orthostatic hypotension. Question 11. A medical assistant is performing ear irrigation to remove impacted cerumen. Where should the stream of warm solution be directed? Option A, directly at the center of the tympanic membrane. Option B, toward the top or side of the ear canal wall. Option C, toward the floor of the external auditory meatus. Option D, at the opening of the eustachian tube. The correct answer is option B, toward the top or side of the ear canal wall. The solution should be directed toward the upper or posterior wall of the ear canal, not directly at the tympanic membrane, to allow it to flow behind the cerumen and flush it outward. Direct pressure on the tympanic membrane can cause pain or perforation. Question 12. What angle of insertion should be used when performing a venipuncture with a standard multi-sample needle? Option A, 5 to 10 degrees. Option B, 15 to 30 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option B, 15 to 30 degrees. Venipuncture is performed at a 15 to 30 degree angle, with the bevel facing up, to allow smooth entry into the vein lumen without passing through the posterior wall. A shallower angle is used for superficial veins, steeper angles risk through puncture. Question 13. A patient with a new diagnosis of type 2 diabetes mellitus tells the medical assistant, "I don't think I can afford my insulin or test strips." To which resource should the assistant refer the patient? Option A. The state's public health department. Option B. A medical social worker or patient navigator. Option C. The local emergency department. Option D. The pharmaceutical manufacturing board. The correct answer is option B. A medical social worker or patient navigator. A medical social worker or patient navigator is trained to identify financial assistance programs, pharmaceutical patient assistance programs, and community resources for patients with medication affordability challenges. The emergency department is not appropriate for financial counseling. Question 14. Which document provides instructions regarding a patient's preferences for medical treatments, such as mechanical ventilation or tube feeding, if they become incapacitated? Option A. Healthcare proxy. Option B. Informed consent form. Option C. Living will. Option D. Durable power of attorney for finances. The correct answer is option C. Living will. A living will is a legal advance directive that specifies a patient's wishes for life-sustaining treatments should they become unable to communicate. A healthcare proxy designates a person to make decisions, while a durable power of attorney for finances covers financial matters only. Question 15. A medical assistant is checking the liquid controls for a CLIA-waived gluconate device. How often should these quality control checks be performed according to manufacturer standards? Option A. Once every month. Option B. On days when patient tests are performed. Option C. Only when a new medical assistant is hired. Option D. Every time a new patient is brought in. The correct answer is option B. On days when patient tests are performed. Quality control for CLIA-waived point-of-care devices must be run on each day that patient testing is performed, per manufacturer instructions and CLIA guidelines. This ensures the device is functioning accurately before any patient results are reported. Question 16. According to developmental psychology stages, a child who is experiencing a conflict between industry versus inferiority is typically within which age range? Option A. 1 to 3 years old. Option B. 3 to 6 years old. Option C. 6 to 12 years old. Option D. 12 to 18 years old. The correct answer is option C. 6 to 12 years old. Erickson's stage of industry versus inferiority occurs during middle childhood, ages 6 to 12. Children in this stage are learning to master academic and social skills. Failure to develop competence leads to feelings of inferiority. Question 17. A medical assistant is calculating the body mass index, BMI, for a patient. Which of the following measurements are required to complete this calculation? Option A. Height and chest circumference. Option B. Weight and waist circumference. Option C. Height and weight. Option D. Age and weight. The correct answer is option C. Height and weight. BMI is calculated using height and weight only, using the formula, weight, kg, divided by height, m, squared. Waist circumference is a separate measure of central adiposity and is not part of the BMI formula. Question 18. When communicating clinical details about a patient's condition to another healthcare provider, which structured framework is commonly used? Option A. SPAR, situation, background, assessment, recommendation. Option B. HIPAA guidelines. Option C. SOAP notes formatting. Option D. OSHA safety data sheets. The correct answer is option A. SPAR, situation, background, assessment, recommendation. SPAR is a standardized communication tool used in handoffs and clinical consultations to ensure all essential information is conveyed efficiently and in a logical order. It reduces communication errors and is widely used across healthcare settings, including during transfers and urgent calls. Question 19. When archiving or purging paper medical records, what determines the length of time records must be legally retained? Option A. The clinic owner's personal preference. Option B. State and federal laws regarding retention periods. Option C. The storage capacity of the medical facility. Option D. The alphabetization style used in the office. The correct answer is option B. State and federal laws regarding retention periods. Medical record retention is governed by state and federal statutes, which vary by record type and patient age. Adult records are typically retained 7 to 10 years, minor records must often be kept until the patient reaches adulthood plus an additional period. Deviating from legal requirements can expose the practice to liability. Question 20. When applying a surgical dressing to a wound, which of the following layers is intended to be sterile and come into direct contact with the wound bed? Option A. Outer elastic wrap. Option B. Primary dressing. Option C. Secondary tape layer. Option D. ABD pad reinforcement. The correct answer is option B. Primary dressing. The primary dressing is the layer placed directly on the wound surface and must be sterile to prevent infection. The secondary dressing overlies it for absorption and protection. The outer wrap provides compression and secures the layers.